On cannabinoid hyperemesis syndrome, I interviewed Dr. Codi Peterson, and I wanted to share all my notes from his interview because he was such an excellent resource. He is also the chief science officer at Canigma, which is a cool place to follow, and he is associate professor at the UCI School of Pharmacy. This will be a long video, but he talks about the symptoms leading up to the cyclical vomiting. And so if you're suspecting gut stuff might be related to your cannabis use, this might be worth watching. I'm Lex Pelger. I do canna education for CD Sciences, the makers of Plus CBD, and I appreciate that they allow me to share public health information like this. I interviewed Dr. Peterson for my upcoming article in the American Journal of Endocannabinoid Medicine about cannabinoid hyperemesis syndrome. If you know any other healthcare professionals who would like to talk about their experiences, shoot me a DM. Dr. Peterson has been working in Southern California since 2018, and he says he has seen a rise in the incidence of cannabinoid hyperemesis syndrome, though there aren't any prevalence studies, so we don't know for sure. He would love to do one if anybody has the money for that kind of work. He's also developing the order set for his hospital, and that's a doctor workflow, which is important because, as the question to start off this video was, is there testing available for CHS? And unfortunately, cannabinoid hyperemesis syndrome is a disease of exclusion. As he said, you should be doing like 4 or 5 other tests to rule out things like gastroparesis or things like that. And he says with his patients, it often takes 3 or 5 hospital visits of the cyclical vomiting before they finally figure out what's going on. So yes, these workups are big. They involve CT scans, X-rays, MRIs, endoscopes. You have to rule out a lot of other things before you can be sure that it's the cannabis. And what makes Dr. Peterson such a great doctor is he's doing a lot of his learning on Facebook groups. He joins to see what the patients are actually saying, what's helping them, what kind of triggers they're seeing. Him and I were kvetching about how lousy the scientific literature is, and there's a lot more learning in the forums. And so he learns from there, and he is aware and agrees with you that there are too many GI doctors who immediately slap on a label of CHS just because someone has vomiting and also uses cannabis, and they don't do enough of the work to rule out the other things. But he's a realist doctor, and he knows that some of his patients don't want to admit that it could be the cannabis. The thing that I think I learned the best from him is there are prodromal symptoms, and those are the symptoms before the full-blown disease. He's like, before people start to get that cyclical vomiting or days of dry heaving that can be so bad that you want to die, they're having GI distress before that. They're feeling unwell. Things like low-level unwellness with heartburn, indigestion, diarrhea, GI distress, particularly in the morning. If you interview people, it's almost always in the morning, which is an odd thing. People are often smoking the night before, or other triggers like alcohol, or a lot of stress, or certain foods. So if you're getting these prodromal symptoms, be aware that it could be the cannabis. See what a tolerance break does for these symptoms. Because two timing things that make it tough is people can get the cyclical vomiting and then they get the general treatment of Haldol to stop the cycle, and then they don't vomit again for months and they think they're out of the woods. But really the only way to know if it's the cannabis is by giving up the cannabis. And another problem is that the vomiting might not stop immediately when you give up the cannabis. It can keep going for 2 to 4 to 8 weeks. You need to be off to see if it starts to go down, because this is an overall dysregulation. It's a dysregulation of the endocannabinoid system, of the guts, of the microbiome, all of these systems working together. So it's important to pay attention if you're getting those prodromal symptoms and they seem to be linked with your cannabis use. He says he often sees people who has these GI problems and then they smoke some cannabis and they feel 20% better. So they think, oh, the cannabis is helping, but it might just be taking off the edge off of something that it's actually causing. So pay attention to these prodromal symptoms. As he's pointing out, people have died from this. People have vomited to the point that it has killed them by electrolyte imbalances and things like that. This is really a serious thing, especially once it gets started. The traditional treatments are fluids or the antiemetics like Zofran, even though it doesn't work really well. Really the thing that's blocks the cycle is haloperidol, also known as Haldol, which is a first-generation injectable antipsychotic. It's a funny thing to work, but it can break the cycle. Maybe it's because of the dopamine, but it's a dirty drug. It blocks a lot of things, so we don't know exactly how it's helping. The other drug that helps is capsaicin. Hot peppers, topical capsaicin, rub it in your skin. But it's very hot. It's not a pleasant thing. It feels like hot peppers. on your skin. And maybe that is working via the TRPV vanilloid receptors. There is a theory that maybe this is what's getting dysregulated in CHS, but none of that work has been done. But it's intriguing that this thing that stimulates your noxious hot pepper receptors is what lowers the vomiting. That and of course hot showers, hot compresses. But be careful with heat. People have burned their skin very, very badly and caused skin diseases from putting too much heat onto themselves. Oh, and one thing I wanted to mention. He mentioned the food list that you tend to see on a lot of the Facebook groups. Certain foods that are cannabimetic, like broccoli, has something in it that lowers the Fa enzyme, which would lower your raise your anandamide levels. So he does see some patients with food triggers, but overall, he doesn't really believe in this food list you see going around because there's so much inconsistency, and he doesn't really see it in his patients. And of course, the last big question is, what's causing it? And he says, listen, the THC is our best guess. It's the one thing that's consistent across almost all of these. And cannabis use disorder tends to be correlated with having cannabinoid hyperemesis syndrome. He is open to the idea of it being other contaminants on the plant, though he is not very open to it being pesticides. He teaches about organophosphate poisonings to paramedics and people like that. And with pesticides, apparently, they are a very acute thing. When you get poisoned by a pesticide, you get the reaction pretty much right away. And that's just not how CHS presents. People are often smoking the night before and they're getting the vomiting the next day. And that's not what pesticide poisoning would look like. So THC is probably the best guess. And he says you do see it the most with concentrates and vape carts. That's the ingestion method that most likely causes CHS. But it also happens with regular smoking inhalation, and edibles also do bring it out. Lastly, he pointed out a case study that I've seen, and it is one case where Epidiolex caused cannabinoid hyperemesis syndrome. Epidiolex is isolated CBD, so it was presumably a pretty sick patient with something like epilepsy, and they were taking huge levels of CBD as well as having a ketogenic diet, and they developed CHS from that. So from just isolated CBD that's happened to one person out there. So, but again, the CBD does alter your TRPV receptors, and so it could be via that. Overall, his advice to patients is you probably won't be able to use cannabinoids anymore. Maybe you can work with your healthcare professional to find something that works. You know, maybe CBG, probably not Delta 8 THC. It's too close to Delta 9 THC. But it is, sometimes people give it up for a long time and they can come back to it in very small ways and use it again, but it will probably alter your relationship with cannabinoids for the rest of your life. And I asked him what advice he had for other healthcare professionals, and he said they should be honest with their patients about and asking about why people need the cannabis that they're taking, trying to find other things that might help them, and not telling the patient that cannabis is junk, that they understand why they need it. And his very last piece of advice was, when you go in, tell your doctor you're using cannabis. Yes, they might slap the CHS label on you, but they need to know that that is there in the mix for figuring out what's going on with you. So there's the ideas from Dr. Codi Peterson. I am going to ask him about the exact testing regimen of 4 to 5 tests that he goes through for the diseases of exclusion. But if you have other questions about this, let me know as I'm gathering data and filling out my bibliography even more about cannabinoid hyperemesis syndrome. Oh yes, and if you want to see more from Dr. Codi Peterson, here's an interview with him on the Pharmacy Cannabis lecture series. You can find it on YouTube. It's over an hour long.